Hello, my name is Roy Poyan, and I'm the Director of Families Impacted by Opioids. I want to thank you today for joining us for this episode of Fentanyl and the Family in Harm's Way. What we're going to look at today is getting a diagnosis. This is very involved. In fact, we recommend that you get a binder and you get 5 tabs, the Avery 5 tabs from one of the office supply stores. And in it, you label those tabs: mental health, medical, and then addiction. Because those are the 3 primary diagnoses you're going to need to keep your eye on. The other category would be alternative services, and then kind of a needs for daily life, which would include social, kind of the Maslow's of food, transportation, social, in terms of helping you to organize how this is going to take place. We realize that this is the person's life, but what we've identified with is that that life is now a part of your life and you're circling around them. And in order to do that, you kind of need to keep your head above, the fray. So what we're going to do is we're going to suggest to you that you should have an ongoing diagnosis of medical, mental health, and addiction. And they're separate. But in many ways, they kind of collide together. So what we're going to do is we're going to get a diagnosis for what type of addiction are we talking about? What stage is that addiction in? What is the plan of care, the plan of treatment for this person? Who is coordinating the different elements that are supposed to make this plan of care take place? If they're supposed to be receiving mental health as a separate diagnosis, what we call a dual diagnosis, now we're dealing with an addiction diagnosis with staging and a plan of care and coordination. And we're also dealing with the same way the mental health as a dual diagnosis. Let's say that's schizophrenia, depression, general personality disorders. It could be a lot of different types of things, anxiety. So what we want to do is we want to say, with that diagnosis for mental health, and as it relates to the addiction, what are we doing in terms of what stage is it in? It could get worse, it could get better. So your idea of where are we is always in motion when it comes to a diagnosis. You can't just sit there and say, well, we got a diagnosis 6 months ago and that's his diagnosis today. It may be that that's his diagnosis, but it may not be that that's his staging. He may have either moved in a more positive or it may have gotten worse, in which case the plan of care needs to change. Because if you're sitting there saying, well, he's got this diagnosis and we know that it's at a mild stage, but unbeknownst to you, it turned into a severe stage. The plan of care never changed in relation to that, and now they relapse. Relapse is often the result of the fact that something changed and the things that helped didn't change with it. So with that in mind, we need to be kind of cognitive of getting reassessments on the diagnosis in order to determine what stage are we at in order to tweak the care plan. And we're doing that for both addiction, we're doing that for mental health, and we're doing that for the medical side of this person's profile. So they could have what's known as a comorbidity, co meaning with. So it could be that they are experiencing, because they smoked a lot of inhalants, broken glass syndrome in the lungs, in which case that has a diagnosis. That has to be treated. So it has a care plan. It has a staging also. So once again, we're diagnosis, staging, and care plan times 3. And that's why we're suggesting get a binder and keep updating this. Stay on top of, does the care plan need to change? If they are on medical assisted treatment and they've decided that they're going to titrate down, well, the question is, did any one of those 3 characteristics change? Did their mental health change as they started to titrate down on their addiction medicine? and their, active participation in, let's say, a support group or 12-step, okay. Now, let's say they stopped going. Well, that was part of his care plan. So now all of a sudden, did mental health change because of that? And if some of his conditions, like let's say nutrition changed, because he's not doing as well, he's not staying on top of things, then did his medical change? This is a very rapidly moving environment when we start to talk about diagnoses. I think we're confused in the sense that we think we have a diagnosis and we leave it that way. No, the diagnosis indicates, once again, I don't mean to be redundant, but the diagnosis indicates a staging. What stage is this condition in? And then the staging identifies a care treatment plan. So where is the care treatment plan? Do you know it? Do they know it? Do the people who are coordinating his care know it? Are you staying on top of them to stay on top of him, to stay on top of the care plan? You'll learn all of these things today, but today's is just the beginning. There's so much for you to learn in this specific issue. It spans out into all the other issues. The diagnosis is everything, but the awareness of how the staging changes in time is critical. And even more important is, did their care plan change with them? Did what we're doing about their stage change so that it's a match? Let's get together at the family table and let's take a closer look at that. It warrants it. And we'll outline some areas of what you can do, and then you can walk forward with this as your process. Okay, I'm recording. You can start whenever you're ready.
Welcome to the family table. We've got a lot that we need to talk about here because it's probably one of the most continuous topics, and yet it sets the stage for everything to follow, and that's the diagnosis. Often somebody would say to me, Roy, I have my brother and he's addicted to opioids or heroin or methamphetamine, and I'll ask them, do you have a diagnosis? And so many times they say, well, he doesn't have a diagnosis, but we know that he's got this problem. And I'm first thinking, all right, number one, you probably don't know the importance of a diagnosis, which isn't their fault. And you more than likely then don't know all of the other things that should be kind of like being set up. So you could be in a much better position if you knew the diagnoses and then the different things that are set up from the diagnoses. So let's get deeper into this as a topic, and we'll take a look at our study guide because it does do a good job of guiding us through that. And the topic is get a diagnosis, and in that we start out by saying that substance use disorders and mental health and medical and the ability to function in daily living and the ability to sustain things like our quality of life are all one and the same. Well, what did I just say? Well, actually, a lot. And what I just said was, you have a situation that you believe is related to substance use disorders, addiction. Get a diagnostic. Get a diagnosis on that. You may have, and it's worth looking at, what they call a dual diagnosis. And it's a mental health condition. And it may be that one came before the other. The mental health condition led to them starting to take, or now that they're starting to take, the mental health came in. And so we have a dual diagnosis that we need to get. So get a mental health diagnosis. And now we're up to 2. And then because they've been using for a while, and this is very coercive to the system's not used to this. This is an invasion of the system. The system's looking at it in the beginning like, what is this? Now, pleasure is sitting there saying, oh, repeat that, please. That was really nice. But reason, logic, and judgment are saying, well, this couldn't be good for us. It doesn't belong in our body. number one. Look at all that it's doing to us. Our heart went up, our digestive system went wacky, our liver and kidney are now functioning in different ways than it normally would if this substance was not in us. So your body, as a medical condition, in all parts of your body, like the endocrine and the digestive, and of course your neurological, your cardiac, your pulmonary, your breathing, all of these systems are being impacted by this invasion of this substance. So the fact that you're repeating it eventually will wear down certain parts of your body and your systems, and you need to be aware of that. Medical, get a diagnostic, get a diagnosis. A diagnostic means that they are going to apply a certain way, an algorithm of examination using blood, x-ray. There's all types of tools that they have other than behavior, which is really all that the mental health group has to make a diagnosis with. So medical can do probably more in a diagnostic. Mental health uses behavior and history and presence and thought process in terms of understanding what the conditions are. And then, of course, addiction in itself, in its behaviors, is more of an observed history and present and way that the present is being conducted. That's the way that they measure in a diagnostic. So if we have 3 diagnostics going on for this one person, it would stand to reason that we have 3 separate stages. A stage for the addiction in terms of its diagnostic, a stage for the mental health in terms of its diagnostic, and a stage for the medical. Well, that's a lot. Well, then again, we're talking about a person, and of course it's a lot. We're talking about a whole person. One of these conditions impacts and has the potential to make it more successful for recovery or make it more difficult, depending on, if you're not breathing well, then that's going to create stress, and you're going to be worried about that, which might create greater anxieties or depression, which might weaken your resolve in managing against a trigger that might have helped you to go down the wrong path in terms of relapsing. So we can kind of see how, as complicated as it is, we cannot just push to the side, okay, well, they've got an addiction. Well, okay, but and now that we're talking here at the family table, the fact is they probably have a lot more than just an addiction, and we should know about that, and it should be diagnosed. And if the diagnostic comes up and tells us a certain thing, then there should be a staging. What's the severity? Mild, moderate, or severe is typically the 3 categories that we find a diagnostic. Well, then that means that there has to be a care plan, a plan of treatment. Often the 2 words are the same. For each of those. Whoa, that means that we're talking about a diagnostic with staging, say it's mild or moderate, with a care plan for just the addiction. A diagnostic, a staging, and a care plan for the mental health. And a diagnostic and a staging and a care plan for the medical. Yeah, that's correct. Well, how do we keep track of all that? Oh, I would suggest you get a binder together and start to categorize and have maybe go to Office Max and pick up Avery tabs and get 5 tabs and stick it in a binder and start to, make record of where are we with each of these 3 types of diagnostics, each of these stagings, and each of these care plans. So what we're starting to do is we're starting to say, kind of makes us into a case management company. Yeah, actually, that's true. In terms of care coordination, that would be true. And then the other thought is, well, doesn't the healthcare industry help me to manage the mental health and the addiction? I mean, they're healthcare, right? It just doesn't work that way. And for you to feel that it should, that's not going to change the fact that it doesn't work that way. So we have to understand, how are these silos set up? And how do we take advantage of each one of them? Because now the family as a system and as a dynamic is involved in case management with the individual. So now where are we going to be with that? Well, we're going to add another category, and that's the kind of social services category of, all right, well, we said that it's rate, you're like, wait a second, Roy, we already said that it's addiction and it's mental health and it's medical, and now you're adding in social. Yeah, they may need peer-to-peer services. They may need foster, or there may be a child enforcement involved if there's a child involved. They may need housing. They may need transportation. They may need employment, of course. And they may need to set up an identity. If they were incarcerated, then there's a whole reentry process that needs to be considered and by the family assisted with in terms of coming back into society. What else? Well, there's faith. So, wait a second. We're talking that there is an addiction diagnostic, a mental health diagnostic, a medical diagnostic, and you're kind of doing a social service diagnostic. That's correct. And you're doing a faith diagnostic. Well, yeah, that's a little bit loosely used as a term, but the concept is the same. You're sitting there saying, where are we with our faith? And, are we doing okay? And if not, what's the plan? So in terms of all these different diagnostics and organizing them, we're really going to have to take an assessment. And then we're going to have to get a diagnostic from the assessment. And then the stages are created as to the assessment and the diagnostic. And then the care plan is done. And then over time, we have to make sure that we do a reassessment, because they may be getting better. They may be, the same, which is fine if it's a good level. And it may be that they're declining. Either way, we want to know. And we can sit there and say, well, is it a visit, an assessment? No, I wouldn't, I would not give any one of those categories of industries the benefit of the doubt. I would say to myself, did they do an assessment? And then I would ask them, did you do an assessment? You could even carry it a little further. What assessment tool did you use to do the assessment? If you really want to kind of hold their feet to the fire, you could do that, because there are definitive standard tools that are used in the assessment process that they use, and they know that. And in that sense, you could look those up on Google and say, MAST assessment tool for this addiction. And it will tell you all the different ways that they are scoring certain types of questions that led them to believe that this is the diagnostic and this is the staging of this disease or this condition. And in the reassessment, that tool is used again. So, not to complicate things, and that's not our attempt, but to inform you, the best thing you can do is create a baseline and say, this is a snapshot of where Jerry is today, okay? And we've included history and other things to the record as part of the diagnostic and assessment process, but it's all inclusive. This is where he is today. And then as we move forward and apply a care plan, and he's, let's say, at severe, we're hoping to see that the care plan has moved them to moderate based on the reassessment. So now we have the reassessment being conducted, and we can then say, okay, now from that, does the care plan need to change? Now there's one other characteristic, and this is part of the whole process, and it's called a variance. You're really learning a lot of vocabulary here that a case management company, they perfectly understand. This is their world. But that you need to understand. So what's a variance? Well, supposedly we said, if we provide this level of service, his performance should go like this. And if it doesn't, if it spikes out, it may be that he had a situation that occurred that caused that change to happen away from what was normally our design for his care plan. So what would be a classic example? Well, relapse would certainly be a classic example of a variance. More than likely, in the care plan, something happened that was a minor variance that then grew to be the total relapse. But we'll talk about that later. The fact is that we have an anticipated level of services that we think by studies and empirically proven process, we should have a reasonable expectation that they will move from severe to moderate. We might make adjustments to that care plan depending on what they're showing us. And then when we do reassessments, that kind of really brings our attention to all the categories to see, well, okay, if we do more with nutrition, then we know that he'll do better health-wise because he's taking in too much sugar, and that's also creating anxiety, or caffeine, or, so nutrition has a very important role to play, and when we don't pay attention to it, it actually has a role to play in the negative. So with that in mind, we're using the care plan based off of the most recent assessment, not the diagnostic. The diagnosis pretty much will stay the same. The staging will move around, and as the staging moves around, the care plan should too. Your loved one should never be without a care plan. So if your provider in any of these 3 categories or 4 categories tells you that a care plan isn't needed, you got the wrong provider, and you need to go out and shop for a new one, because that person's not doing their job for whatever reason, and you're not going to correct it. You're not going to insist that they do something. If they're not doing it, that's something that they've decided they're not going to do, and your insisting isn't going to change that. Just pick up and find another place that understands that a care plan is a part of what you're paying for as a consumer. It's also a part of good clinical practice, and also as a society, good society norms. I mean, gee, even the pastor checks in on you and says, so how are you doing? How's your prayer life? How are you reading the Bible? Are you participating in any of our groups here at the church? They'll test and assess. We're always assessing. The question is, do we know why and to what value, and then what response we're giving that result of what did the assessment tell us? So let's take a look at the workbook now and kind of see how it will guide us through the process of getting an assessment. And inside of the workbook, you'll find that we're going to discuss areas of psychological symptoms. And this is just the beginning of your learning. Matter of fact, all of our materials are just a starting point. You don't take this episode, read these books, and say, got it, let's move. That's not the case. This is okay, I understand that this is an area that we need to spend more time in, and now we're going to go to our computer and Google search engine and find more information. We're going to go to YouTube and find videos. By the way, YouTube's a great tool. There's a lot on addiction in its different categories on YouTube. And what we want to do is take a look at inside the workbook what areas it asks us to focus our attention to. And symptoms are certainly one of them. The inability to stop using is one of the symptoms. The use and abuse of substances despite health problems, meaning the person knows that this is hurting their health and they're continuing to go back to it. Dealing with problems, they just don't seem to be able to use judgment, logic, and reasoning, their frontal precortex, because those areas are not being engaged. Their brain has rewired itself to just pleasure, and we'll learn more about that when we start to talk about the brain disease of addiction. They seem to be obsessed. They seem to have an obsession over something. They're taking way too many risks, and initial doses are very large, and you wouldn't really know that until later, but that is what that would tell you. So substance use disorder can impact the person in a lot of different ways. It tends to socialize itself in almost a subunit community. So they have their own norms inside those that abuse and misuse substances. And I don't think that's a surprise to anybody. Those norms are not your family norms. We can assure you that. They're self-driven, narcissistic, and very much damaging to themselves, the family, the community, and everybody around them. This is kind of a disease that once it's part of the person, it actually, if it were given a life and a name, it actually goes out and tries to infect other people. okay? It rewards them with the same reward that this person got started with. And now they're drawing in other people. And then it corrupts and challenges the norm of the community that is not a part of it. So it's very coercive to any place that it is. It doesn't play well in the sandbox, you might say. The fact is, it is destroying our society. And it's doing it one person at a time rapidly. And now it's become deadly with fentanyl. So the whole theater, the whole game has changed when it comes to addiction because it is so deadly, even by accident. Most, of course, by accident. So when we start to look at things that we start to see them do, they start making sacrifices in order to have the substance involved in their life. They might sit there and say, no, I don't want to go camping, and yet they love camping. I don't want to go on the boat today, and yet they love boating. They drop hobbies and activities. They start to isolate, and they start acting in secrecy and solitude. They're constantly in denial. They deny that they have a problem. They deny this. They deny that. They're always denying things. Excessive consumption of substances comes from a buildup of tolerance. And that can happen rapidly or slowly. But you may sit there and say, well, he's only using a few times. You have no idea how many times they're really using. You're only seeing that they're only using a few times. And even if that's the case, it's a few times is still enough reason to engage. And that's what we're talking about. When you engage, what can you expect? Well, you can expect all of this. There's some great videos on how they hide it from you and the containers that they use. You should look at that. I mean, it's not a matter of snooping. The fact is, if they're using, you need to get them into a treatment center. The two should be almost at the same time, universally. There is no, let's wait and see. With this drug and fentanyl and some of the other products that are coming out that are deadly, you don't know how much time you have here. I don't mean to be an alarmist, and I don't want to frighten you into you wouldn't possibly do anything because it's too much to handle. You can handle this. Once you kind of have an idea as we break it down in these episodes, you will handle this. Either way, you're going to, because it's going to play out now that it's here. So by taking the time to understand it better is certainly to your advantage. There are certain screening types of tools that primary care and other healthcare providers, even chemical dependency counselors and chemical dependency assistants can offer. So it doesn't take a high level of healthcare to get to a craft screening tool, that's CRAFFT screening tool, and that will help them determine, okay, what are we dealing with here? And then maybe that would require them to, now that they've screened and said, yeah, you definitely have this situation. We don't know how bad it is. Let's do an assessment. The assessment would produce a diagnostic, and we've already talked about that. So there are areas that you can then take a look at. When they start to look at severity, meaning what level, mild, moderate, or severe stage, they're looking at the amount, how much control they have, the time frequency that they're taking it in, the level of cravings, the obligation that they're giving to this drug, what it's doing to them socially, what their activities are, the hazards that this is creating, and the harm that it's creating. So tolerance is also considered, and withdrawal. Okay, so these are all kind of characteristically brought into, so what is the severity in terms of assessing? And what they'll come out with is it's a mild, moderate, or severe assessment in terms of its staging. Now, once again, that changes over time. And if the care plan is good and working well, you'll find that they move from a severe to a moderate and a mild. Don't be overly frightened by the fact that they've moved. They will move up and down the scale. What is most important for us is that we're doing the reassessment and we're getting the right levels of eye contact on this behavior so that professionals can really help us with changes in the care plan. The assessment, the diagnostic, the staging, the variances, the care plan, these are all terms that you're going to start to become more familiar with. But don't let them frighten you. It's all here to help you. And it's troubling for a family to sit there and say, we shouldn't need help. We shouldn't be dealing with any of this. We didn't ask for this. All of that's true. And we feel for you when you're going through this. All of us that will become a part of your life. It's your journey, but we have an understanding either through lived experience or through the academics and studies and trials and ways that people have applied themselves to really put together the best possible treatment plan, response. And in sharing this with you now, we can then bring the families into this understanding, this fold, because it's you that sets the environment that successful lifelong recovery will take place in. So your ability to determine a solution, develop a decision, and design a plan of action based on the conditions that have been identified by using the 3D coping skills is very important when we start to talk about get a diagnostic, because there's a whole bunch of different characteristics that are now going to come into play that you need to respond to effectively. And that's what knowledge does for us. Keep in mind, we said this before, that knowledge is empowering, but you don't have empowerment until you start to get other people involved. That's when you have empowerment. Now you can do something with the knowledge. So when you see educational series that are being offered in your community, go to them, okay? Learn, but learn with the attitude and the idea that we're going to act on what we learned. Otherwise, it's just knowledge, and I don't really know, other than making you feel good that you know what's going on, that's going to do as much for you as we know what's going on, and from that knowledge, we're now going to do something. We hope that you find all of these materials to be of value for you. They're designed for such. And we ask that you take the time to share them with others. Ask them to view these programs and these episodes, and ask others to carry this kind of material, because you can pick this up on our website as well as the Access TV station that's carrying this. We want to thank everybody that's been involved in all of these studies. We want you to know that there is an enormous amount of intellect poured into these topics. None of these materials that we're providing you are ours. They all come from different segments of the industry, brought into specific issues, and then brought down to a level that we as families, as regular people, can digest and, more importantly, apply and use. Hello, I want to thank you for continuing to view our episode. And we're now going to work into the area of the 3Ds. This is an important characteristic for the family to develop skills in. And we'll start by taking the time to look at an issue and then determine the issues based on the area of determining a solution, developing a decision, and designing a plan of action. By using your Module 3 workbook and going to a specific issue, you'll be able to find that the first step in that 3D skill set is the FTR, the Family Transformational Model. And the Family Transformational Model is a set-up way, each time the same way, that we will take 5 categories to look at in determining a solution. And each category is going to have 3 questions. So let's get started. The first is to define the issue. Naturally, we'll want to know what the issue is. The word issue is really problem, but we're saying the word issue is, the reason we're saying the word issue is it's just a little bit easier to digest, because it's not always a problem. Sometimes it's just something that's happening, and we need to determine a solution to it. The next question is, how does the issue impact the family? We need to know that. We need to know, we have an issue, that's fine. The issues can exist, but if it's impacting the family, in what way is it impacting the family? And then what steps can the family take to prepare and then respond to the issue? That's very important for us to know. The fact is that this issue exists and it's impacting the family. We tend to believe maybe there was something we could have done to kind of get ready for it. And if there was, then we would want to have taken those steps, which is what all these episodes are about. And then who can help assist us and the family in our response? So we want to start to ask ourselves, we know that there's an issue, we know that it's impacting the family, and there are things that we could do to prepare for this, but we're probably going to need a resource, information, another person outside of our family, or maybe one of our family members specifically can use their functionality and contribute. So we want to identify that. And then what should the family expect as their outcome? And kind of a start with the end in mind thought, where we're saying, if we're going to do something, it's going to result in something. So is that result desirable? Is that really what we want? Because if we're going to create a solution, then we want the solution's outcome to be what we expect it would be. So in each of these categories that I just described, 1 through 5, there are 3 questions, and we're going to ask ourselves each of these. Let's go back into the first category, define the issue. Clearly state what happened or what will happen. We want to know very clearly what happened or what's likely to happen. And then write that down. Identify who's involved or who should be involved. And then what would you like to have happen or like to see happen? The third question in every category is going to be used. You'll see how in just a minute. But just remember, the third question in every category, so this question right here, the way you answer it, will be reused. Now the next question is, how is the issue impacting the family? Who in the family exactly is impacted? In what way are they impacted? And then the third question is, what is needed to move forward? And then the third category is, what steps can the family take to prepare and then respond to the issue? The 3 questions again. What needs to be done? And then prioritize that list. Who needs to be involved? And then what will it look like, the third question, what will it look like when completed? Then the 4th category is, who can help and assist the family in their response? The 3 questions are, how to search and organize this organization to help you. In other words, it's not enough that you know you're going to go and introduce yourselves to a treatment center in your community. You want to start to determine, how do I look for them? and organize my way of seeking help, because it might not just be that group alone. You may also need other services to kind of start to create a who can assist us. And it may be many different types of people. What to ask from them, and then what to expect. Remember the third question, what to expect. And then the fifth category is, what should the family expect as their outcome? Well, that has to do a lot with timing. And if it takes a certain amount of time, let's be realistic of what that is. That has something to do with the expense of the involvement, of getting involved in this issue. And then the third question being required changes, our changes as family members, for this response to successfully take place. Now, let's state what our solution is. Hey, this is the great news. You've already developed your solution. By answering each of these three questions, the third question in every category, you'll pull forward now into your statement. So your first sentence of your statement is the third answer in the first category. What would you like to have happen or like to see happen? Well, that becomes your first sentence. So what your first sentence for your solution statement is, what we would like to see happen is, and you just pull your answer from there to here. Do the same thing with the second category. How does the issue impact the family? Using the third question's answer, what is needed for the family to move forward? So now your second sentence is, what's needed to move forward is, and now you're accumulating these answers from these categories, the third question, and it's actually becoming your first sentence, your second sentence, your third sentence, your fourth sentence, and your fifth sentence in your solution statement. So your solution statement is going to sound something like, what we would like to see happen is, and what's needed to move forward will be, and then the third question from the third category, what it will look like when completed will be, and then what we expect will be, and then what's required for us to have a successful response is. Now those are your 5 sentences. You've just constructed your solution. And this is how you go back using a model for creating a solution. For any issue in life you have to face, you can use this as a way of approaching it. Now let's go to the other area, which is the second coping skill, making a decision. Let's make a value-based decision. Let's make a decision each time that kind of balances with what we value most. So first we want to determine, what are our values? Well, the best way to do that is to write down on a piece of paper, what types of things do you as an individual value most? And each member of your family can do this in a kind of a group exercise. And then once you've done that, I value love, I value honesty, I value relationships and sharing. These could all be an individual's 1, 2, 3. Then prioritize them. Which of the 1, 2, 3 is most important? Then have each member of the family do the same thing. And then you can sit there and say to the family, what was your number 1? What was your number 2? What was your number 1? What was your number 1? What was your number 1? And then what was your 2? What was your 2? What was your 3? What was your 3? And where you start to see many people in the family say, well, my number 1 is relationships, my number 2 was trust, and my number 3 was love. Well, then you talk to another person, they say, well, my number 1 was love, my number 2 was personal expression or confidentiality, or so they mentioned something different, but they did mention love. And then the third member of the family happens to mention love also. You know now that love is a value of the family. So whatever decision you make, you want to balance it on the fact of, does this disrupt our values? If it does, at least you know that it does, and to what degree. You're calculating that. But at least also you're including, what do we value most? Let's make sure our decisions don't counter that. And now, in the first step, we're going to identify exactly what's happened. And this is, by the way, in your book, okay? And it is for each of the episodes. Now, identify exactly what's happened What happened? How did it happen? Who did it happen to? Then the second step is analyze the situation, assess the problem, identify the problem, and in what areas did the problem create an impact. You're writing all of these down. The third step of that the third step in the decision-making model is what is the number of one contributing factor? What is causing this issue to take place? You need to know that before you make a decision. The fourth step is, now that you know the number one factor, you need to go out and find out what information there is about this. Your primary source, you're going to go to the actual person or organization that's involved with this and ask them, what is this issue, and help us to understand it better. The secondary source would be somebody's telling you this happened, or somebody suggests that you should do something a certain way, and it's coming from somebody else other than the primary source. It could be an article, a clinical paper. These are all secondary sources, and you gather them and you make them part of your primary, secondary information gathering. The third area that you look at is your gut. What does your gut, because that's often where our faith comes in, and other things that are very important when making decisions get included. So trust your gut is what we're saying in the decision-making process. The fifth step in making a good quality decision is where you're taking a criteria and saying, let's take what we're going to make a decision about and let's balance it on the criteria to make sure that we're covering all of our bases. And this will ensure safety of your loved one. Is safety a part of what's being considered? And do we have the resources that are needed to do the decision we're looking at? And then do we understand the timetable? Is it realistic? And do we understand the negative impacts? Because every decision has a positive and negative. Well, identify what the negative outcomes might be so that you can weight the factor of, is this a good decision? And then would you do this would you ask others to do this if they were doing it for you? Meaning it was done for you or to you. Is this still a good decision? These are all areas that you want to take a look at. The third coping skill is in the area of the family plan of action. And everybody could say, well, Roy, listen, we're just going to go out and do it. Well, it's going to get done a lot more effectively. I want to warn you that the addiction industry is not organized. And then again, either is the family. So you're taking two disorganized organizations and you're putting them together. So a plan is a very good idea. The other factor is you're going to more than likely require the assistance of a lot of different groups. And as time goes by, those groups are going to change. And now it's a whole new set of groups that you're dealing with. When you're at the hospital, the ER, that's what that is. Then you move over to detox, that's what that is. Then you move over to therapy and treatment, and that lasts for 16 weeks. That's what that is. Then you're looking at sober living, recovery, maybe incarceration, and then reentry, on all that's involved in that. So there's all sorts of reasons why a plan put on paper based on the decision and the information gathering that you've made, based on the solution that you want to use, are very good ideas. It all comes together with the plan of action. Then you take the plan of action and you go find a professional to help you. Everything that we've done up to now is to position you to a place where you can be properly assisted and directed and supported. This is what's often missing in the families. This is what exhausts the families. This is where the families get into fights internally on. So, for that reason, we're going to apply the 3D coping skills. Determine a solution. We're going to develop a decision, and we're going to design a plan of action. And we're going to do it each time. I hope this is helpful for you. I'm confident it will be.